Hello Bola, we are from Group 6 and we're going to present our findings about top-down approach analysis of large-scale social restriction policy in DKI Jakarta. Okay, this is our table of content. First one, we're going to make an introduction, and the next one we are going to present our methods and policy output, target group compliance, real impact of the policy, and the last thing is conclusion.
For the introduction part, we will discuss a brief overview of the article. So it is stated that in the article, DKI Jakarta has the highest population density in Indonesia. In fact, it is ranked as the second province with the highest positive confirmation cases of 12,435 people, which concludes of 19.5% among 93,749 cases in Indonesia. And the objectives of this article is to analyze the impact of policy implementation in terms of policy objectives and community compliance. Beginning with the timeline of the pre-PSBB policy, first on March 11, 2020, the WHO declared COVID-19 as a worldwide pandemic. In Indonesia, the health public emergency status was announced on March 31, 2020 through Presidential Decree number 11 of 2020. And on the same day, the government established a policy of large-scale social restriction as a form of government intervention to prevent the spread of COVID-19 chain. And the governor of Jakarta announced that PSBB would be effective from April 10th of 2020, and the instructions in implementing PSBB are regulated in DKI Jakarta Governor Regulation number 33 of 2020.
Hello everyone, my name is Aulia Annisa and I will present the research method used by the article that our group chose. So the research method used was a descriptive qualitative method, and the writers explored the expected results of policy implementation, expected policy objectives, and how the community compliance as the target group to reach the results of research. And the study also uses a top-down model approach by using an implementation analysis framework from Sabatier and Masmanian, and it focuses on the stages of policy implementation process.
Okay, my name is Citta Azarine A, and I'm going to present the policy output. Regarding the policy output, the main policy output of large-scale social restriction policy is Governor Regulations number 33 of 2020, which regulates the technical guidelines for the implementations of PSBB in DKI Jakarta. Then there are other policy made to ensure the implementations of the PSBB in Jakarta. Next slide.
Okay, so I'm going to present target group compliance. And based on our findings, we decided to use community compliance as our assessment, and based on the government regulation number 33 of 2020, the implementation success and the community is adapting to the PSBB regulation.
Now we're going to discuss the real impact of the PSBB social restrictions. We can see from the chart here in figure 3, it is a table made of comparison of Google's mobility index between national and DKI Jakarta. The red graph here represents DKI Jakarta mobility index, and the blue one represents the national mobility index. So before we get into the main point, we need to know about reproduction number. The reproduction number itself is, therefore, if we want to see the real impact of PSBB, one of them can be seen from the decrease in the reproduction number of RT value. It means that the level of transmission, if R is equal to 4, it means that one person has the potential to transmit it to 4 people. And if R is less than 1, it means that the potential to transmit to other people is almost non-existent. In this slide, we provide the data from the University of Indonesia's Faculty of Public Health in the governor presentation at June 4, 2020 in the press conference. It is showed that before the period of the PSBB, the value of RT decreased 1 to 1.03, and at the end of the mass PSBB, it is 0.99, which is, we can conclude that there are certainly impacts of this policy implementation. So basically, as I have stated before, the estimated was close to 4 And after the implementation, it was rapidly decreasing.
Okay, so I'm going to present conclusion. So to sum up our findings and our presentation, the first conclusion is top-down implementation approach is a central command structure from the government to the policy which impact the public. The design relied upon government hierarchical system. And the third, Indonesia has helped to decrease the spread of COVID-19. It can be seen from the parameters of the reproduction number in DKI Jakarta. And the fourth, there are many examples of how several countries in the world that gave full authority to their local governments.
The researchers gave at least 3 recommendations. So first, by giving a reward as an appreciation from the government to the community. For example, by giving a tax exemption for workplaces that implement the PSBB successfully. And secondly, by providing resources for the target group. So assistance from the economy and also psychological assistance to the community. The government is expected to be able to facilitate the people's needs by providing assistance, for example, providing new jobs for the communities that are affected by COVID-19, and also providing adequate health facilities. And lastly, there should be changes in community behavior, such as creating discipline habits for health protocol, even after the implementation of PSBB. And that is all from our group. Thank you for your attention.